Good afternoon, everyone. Welcome to our Veteran Access Forum. We are so glad that you both are here, and anyone who's online, we want to welcome you as well. So today's goal is to go through our different areas under Access. So my name is Dr. Kendra Lee. I'm the Associate Director for Access, and these are all the service lines that fall under my purview. So I have community care. Right now, the Chief of Community Care, we're recruiting for that position. I'm over HAS. Mr. Dumas is the chief. He's not here today, so we have a representative for HAS here. Group practice manager, Mr. Yates is here. East region and West region. What those groups are the outlying sites of care. So this is our main location, but we have 23 outlying sites of care. So when you think of outlying sites of care, you want to think about Cobb or Pike or Pickens or Lawrenceville. Those other locations that are not the main campus are our outlying sites of care, and we have them separated by East region and West region. My team focuses on the buildings for those locations, but they also correlate with nursing and the chief medical officers at those locations. So we work as a team to make sure that those locations are being taken care of as a team. So that's where East and West region comes in. So community care is still on their way, but I did want to give some updates that I have. Oh, you're here for, okay. So real quick before we go to community care, I wanted to share that recently I learned that through My Healthy Vet, if you have notifications that you've cut off, you will not get any notifications. So for example, you won't get your lab notifications. You won't get this if they're all cut off. So if you have My Healthy Vet, please, please, please make sure you go back in and cut those back on. Now, if you cut off GovText notifications, you can cut those back on, but you have to do a more formal process by submitting a memo just to make sure that you get those cut on. And so we're working to communicate with veterans better. We use a lot more technology because we have less staff, and so that allows us to be more efficient in how we communicate, and it helps us to better follow up and track those communications. So we want to make sure you're getting the information that you need. So having those notifications on is very important. We do understand we send out a lot of notifications only because we're trying to improve communications in general. So bear with us, but we do appreciate that. So with that being said, thank you again for being here. I want to bring up our community care representative to talk about updates with community care.
Hello, I'm Jai Bryant. I'm standing instead for Merlan Richmond. I'm the program specialist for VA Community Care. I'm here to talk about the VA Community Care process. The VA Community Care process, it starts with the creation of a consult. The VA provider is responsible for that portion of the process, which you will have your conversation with your VA PCP or specialty care clinic. And if they create a consult for you, then it will translate over to community care. Once community care receives that consult, they have a minimum of 2 attempts that they have to make in order to contact you for scheduling, to get your preferences of where you would like to be seen. If you don't have a preference, then they will pick a place that's close to your address. They will use your address to find that, after which an authorization will be created and sent over via fax, or for some of our like dental providers and stuff, we use email, and we'll send that over to them in order for them to do a clinical review of your referral, get your referral process, and get you scheduled. Okay, this is our community care guidelines, timelines, excuse me. So it all depends on the specialties, depending on how long it takes to get you scheduled for your first appointment. So there are ways to expedite your scheduling. So always keep your contact information updated. and you answer calls. If you're expecting community care to call you, I would say answer unfamiliar numbers, because unfortunately we don't have the option that it may come up as unknown. Also, review your messages in My Healthy Vet. If you are registered with My Healthy Vet, we strongly recommend that you are registered with My Healthy Vet, because that's a great way of communication for us. We also have a self-scheduling option where once you establish where you would like to go and be seen, and we've sent the authorization over, we can send over the information to you and you can contact them yourself and directly self-schedule. And as I stated earlier, we recommend that you register with My Healthy Vet for secure messaging. The benefits of using secure messaging is you can send messages anytime and avoid long phone wait times, especially during peak hours. There's the documented message thread, reducing miscommunication, making follow-up easy. We have a 3-day window in order to respond to those messages. So you'll always get a response. And as I said, it's documented. So we'll be able to go back to any messages that was previous. In the communication directly with the assigned scheduler, we assign them to the scheduler. According, your secure messages will be assigned to the scheduler who will be handling it. And this slide just talks about self-scheduling instructions. Once the console is active in community care, veterans should send a secure message via My Healthy Vet to ask an Atlanta Community Care question admin with the following details. It should, on the subject line, it should include the specialty and let us know that you want to self-schedule. In the body of it, state a preferred provider or indicate that there is no preference. And in the absence of that preference, the staff will select a provider, as I stated earlier, based on your address. If you are using dental, there is a separate community care portal we use. It's you would pick the Ask Atlanta Community Care Dental admin for dental, and for all other specialties, you pick the Ask Atlanta Community Care question. The instructions for self-scheduling. After receiving this message, an authorization packet will be sent to both the veteran and the chosen provider for an appointment. In most cases, it takes community providers at least 2 days to do the clinical review and load the authorization for them to contact you for scheduling, or for you to contact them for scheduling. And that's why we just ask that you give them at least 3 days before reaching back out to say you haven't been scheduled. The veteran will be responsible for any bills if they schedule or attend an appointment prior to receiving an authorization. So all authorizations through community care have a beginning and an end date. So it's imperative that you pay attention to those dates, because unfortunately we aren't able to manipulate those dates. When you self-scheduled, you are required to send us the scheduled appointment date and time. That information is important for billing purposes, so we need that information in order to put into the system. The next bullet point says reply to the original authorization message with its date and time, or send a new secure message with the subject line. This step is required to ensure referral duration is maximized and VA has accurate information for billing. If an appointment was made but not reported to VA, the consult risks being canceled and returned to your VA provider. At that time, any expenses incurred will be your responsibility. And that completes the community care portion. Thank you.
Thank you for sharing that. Can we go back? I wanted to emphasize a couple of things. So as it relates to self-scheduling instructions, that's very important. We are trying to expand the amount of opportunities that veterans have available to them to schedule, right? Either in community care or outside of internally. So one of the things we're working with our MSAs, both in community care and in HAS, is for them to be able to schedule internally or externally. So if you're eligible for community care and you call and you meet wait time or drive time, any MSA should be able to schedule you. Now, if you don't have some of the documentation, that's where it gets a little dicey, but we're working on ways where both teams can communicate to make sure all your paperwork is in and we can get your appointment scheduled as quickly as possible. One of the things that I do want to highlight is if you don't have an appointment, or you go to the emergency room that's outside of the VA and you want the VA to pay for it or it's something that's covered, you have 48 hours, I believe, right? 72 to call the VA, say, hey, I had an emergency appointment or emergency room visit and I would like this to be covered. If you do not make that known within the 72 hours, the VA will not cover it. It's not because we don't want to, it's because it doesn't fall within the required timeline. And that's something that's outside of our control. And so I don't see the number up here, but we can get that number to you. You can come in if you like. Okay. So that's something I want to make everyone aware of. Can we go back up? Keep going. Keep going. I wanted to emphasize secure messaging. Secure messaging and My Healthy Vet are basically one in the same. There have been some changes with how you log into the system, and it follows a lot of the federal government new login requirements. So they require a real ID. They have the authentication codes that they're requiring. It is a hassle, but it's a hassle for everyone, so you're not alone. We do have employees that can help you go through that process if you're having a hard time, because we want to make sure that every veteran has access to it. So anybody that's having issues, you can reach out to our teams and we can get you connected with the folks that can help you get access to that. And if you go back a little bit more. This is very important. So oftentimes, we have been working to update all of our phone numbers and how we communicate with you all, but sometimes we can't reach out to you. And so please always make sure you're updating or at least verifying your information, because if it changes, that makes it harder for us to connect with you and get the information that out to you. I'm a type of person, I don't like to answer unknown calls, so if you are one of those individuals, I definitely understand. But again, that's why we recommend My Healthy Vet, because they will send you a message in that portal as well. So if you don't answer the call, you can check My Healthy Vet, and then if that number calls you again, you'll know it's probably us and not somebody else. So things to think about and things to consider. And I think those are the things I just wanted to emphasize off of these slides. So again, thank you for coming and supporting. HAS, we are ready for you, Mr. Rashad. So that's not Mr. Rashad, I just want to point that out.
Yeah, no, that is not me. So just a few updates from Health Administration Services. We'll start off with some stuff from transportation. Just making some announcements on what our new shuttle times are. We did have to make some changes to the shuttles just to make sure we could accommodate as many of those and as many people as we possibly could. So sharing those updated times. Those shuttles are running from very early in the morning, 6 and 6:30 in the morning, all the way until the afternoon, around 4:30. They stop running. Next slide. So for Veterans Transportation Services, you can request a ride from us for your medical appointments. The main line that we'd like for you to use is that calling our main phone number here, the 321-6111 phone number, and using the extension 203245. We have some folks set aside to answer those calls. We do ask that you bear with us. It does get backed up a little bit because we do have a lot of folks that request transportation assistance from us, but they are there to help you with that. We also are including some additional extensions that you can use if you're not getting a fast enough response from that main line. Next slide. If you need a ride to any of your appointments, reach out to us. You can come in person here at the main hospital. There's a desk on the first floor near oncology and the pharmacy. Those folks are there from 7:30 to around 4:30-ish to help you in person get set up for any transportation needs that you may have. You can also send us a secure message with your transportation needs. We've got folks who will be answering those and responding to those to help get you scheduled for transportation as well. Next slide. All right, so let's talk about eligibility a little bit. Am I eligible for VTS or SMT? So all veterans enrolled in VA healthcare have access to VTS. And that access allows for us to pick you up and get you to appointments within a 25-mile radius of our medical center here. We have pared that down to 25 miles within or around the medical center, specifically because the Atlanta traffic does hold us back a lot of times when we're trying to get folks around town to different places. So we want to make sure that we are maximizing the availability of the service by kind of limiting how far we can go. But should you need to go further than that, we have other options to get you there via Uber or Lyft or other options that we have. For special mode, this is covered by VHA. We do have some contractors that help us with special mode, whether that be a need for a wheelchair accommodations in your transportation or stretcher accommodations in your transportation. That is done by consult, so your provider will need to put in a consult for that to let us know which mode of transportation it is that you need, and then you'll follow those same processes for scheduling with us to make sure that you have those rides and those accommodations when you need them. So for normal care appointments, you can schedule those with us through our VA online scheduling. We have a plethora of clinics on there that are available for online scheduling. You'll go on there, you make a request for an appointment, and someone will make sure that you get set up for that. We are working on a new system where when you put those requests in for those appointments, the appointment is made by the system in real time. So some exciting updates coming for online and self-scheduling for your care. For other modes of care, you can either schedule that appointment at the front desk when you're here. That's the best way to make sure that you've secured the appointment. It's in the system, and you've had that conversation with somebody to make sure that your appointment is definitely set. Next slide. But you can also call our main line here at the medical center. So you'll call the 404-321-6111 phone number, and there are options there for scheduling, and you'll just choose the clinic with which you're trying to schedule, and that'll get you over to some folks who are sitting waiting to assist you with that as well. Moving on to ID cards, our next VIC card event is happening at Carrollton Trinka Davis CBOC on August 5th from 9 a.m. to 2 p.m. Staff will be out there to help you get set up with a VIC card. You'll come in, we'll put you in the system, make sure you get a good picture taken, so come prepared for that, and that card will be mailed out to your home. Should you need that card, and not be able to make that particular event, you can still come to the medical center at any time down to our welcome center, and they can help you with that on any day during business hours. And last but not least, you should be receiving appointment reminder cards when you're checking out from your appointments of care. Whether you're here at the main medical center or at the CBOCs, cards will look like this. If you're not getting those, just make sure you let us know, ask someone. We'll make sure that we'll provide that card for you, just so you have a secondary reminder of when your next appointment is.
Can we go back to the cards? This is also important. Again, back to communication. If you are looking to have someone face-to-face, your MSA that's at your location, say again, you're at Lawrenceville, your doctor's at Lawrenceville, your nurses are at Lawrenceville. You also have MSAs that are at Lawrenceville. They will be helping you with your scheduling for those appointments with your primary care. It's called a PAC team. So the main PAC team is the provider, the nurse, and the MSA. And so it's really good to build those relationships so that we can make sure that, one, we're giving you the care that you need, and that we're supporting you as best as possible from not only a clinical standpoint, but also administrative standpoint. So that's why we came up with these business cards to kind of send out so that you leave with an updated number that works and a person that you connected with that you can talk to going forward. So we're excited about this. This is actually a new initiative that our team came up with that we've been pushing out, and I'm excited for the changes that'll come from that. So thank you for pointing that out. Next, we'll have Mr. Jamel Yates. He is our group practice manager.
Yes, good afternoon, everyone. First, I would like to say thank you for your service and thank you for those who support those that serve. My name is Jamel Yates. I am the group practice manager for the facility. For those that's not familiar with what the group practice manager does, we work with the clinical services, the administrative services, as well as community care to ensure we have enough appointment slots for those veterans that desire care. So this first diagram in the center is showing myself as the group practice manager. I have an associate group practice manager named LaWanda Knotts. She focuses on surgical services. And then I have an additional group practice manager, associate group practice manager named Judy Hand. She focuses on primary care and mental health. All the other services I focus on. The diagrams around the center diagram is just a couple of the things that we are doing to improve that access for all of our areas. So that top one, top green one, it actually says annual grid validation. So HAS is responsible for that, but the group practice managers are working with them, and what that is making sure that all the grids are set up appropriately, that we have the slots, that the time frame for the slots is set up, to identify a provider for those various slots. The next thing to the right is the open slot management. That system really is helpful, especially in times when you have a manpower shortage or a staffing shortage. What that system does, it actually look at all the grids, and if there are any open slots, if there's a veteran with an appointment far into the future, it sends out an automatic message to that veteran, offering that veteran that earlier slot. That veteran has the option of declining it or either accepting it. Where that helps us is we are also looking at what we call utilization, the slot utilization, meaning if a provider have 100 slots, we would like to have all 100 slots filled. Oftentimes, slots go unfilled, especially if they're not incorporated in the open slot management. The next is talking about the RN bookability. There's a new process going on where we add making sure that the nurses are working up to their capabilities. That is helpful because there are oftentimes a provider is bogged down with doing something that maybe another specialty can do. And that's where this is making sure that the nurses are incorporated in that process in the hopes of freeing up more time for the providers. Other options that's going on, projects going on, looking at ways to improve access, strategic planning. There was a strategic planning conference held between March 16th and 17th. Basically what we did was we identified 3 stop codes, specialties, that actually can improve. We did a multidisciplinary team. They looked at them, found ways. It could have been either adding additional slots to that provider grid. It could have even been slots that were not used, reducing those slots, and then taking that time for that slot and moving it somewhere else. For example, dermatology may have had an 8 o'clock slot that never went filled. That meant that provider at 8 o'clock had an empty slot that never was used. But then we seen another clinic within dermatology that had a long wait time. Working with the services, we removed that 8 o'clock slot and then gave that 8 o'clock slot to another clinic that needed an additional slot for patients. Wait times, again, decreasing the wait times for 3-stop codes, same thing. Veteran, we putting them in open slot management, we adding additional slots, we hiring positions that may have been vacant for a while, all of that to ensure we have enough slots. And that actually has an impact on community care, because as a veteran, if we can't get you in within a certain time frame, that qualifies you for community care. So again, adding all these extra slots, reducing the wait times, help also reduce the cost of community care. RVU projects. RVUs, relative value units, that is just basically the productivity of our providers. We are continually working to make sure the productivity of our providers is as high as it can get. So what we did was we looked at the RVUs for 6 different areas, meaning in layman terms, open slots. Every slot represents a productivity or RVU value. If that slot go unused, then it's going to show that provider is not being productive. And also, on the larger scale, on the national level, it's going to appear that that provider is not as productive as they can. So we have an ongoing project with that. That's going pretty well. We identified some things that we're working on and fixing. Next slide. Okay, so this slide is just talking about some of the factors that affect wait times. High demand for appointments. Again, we have services such as sleep medicine, physical therapy, that there's a very high demand. But as I mentioned before, if we don't have the slots for them, then they get to go out to community care, which then increase community care dollars, where we prefer to have those dollars in-house because by keeping them in-house, that actually makes us eligible to get more money so we can hire and bring on more services. Limited provider availability, impact of cancellations and no-shows. I'm going to hold off on that no-show one because that is going to be an ask from us in the VA to all our veterans. So there's like 3 slides that's dedicated to that. So next slide. So this is showing our wait time for primary care. For primary care, the target wait time for primary care is 20 days. If we can't get you in within 20 days, that makes you eligible for community care. So one of the projects we actually have been doing with primary care, we've actually been working with the service to add additional clinics so that we can actually get those veterans in. So as you can see, I'm going to point up here for a second. We were at a wait time as high as 48.2 days. Once we started adding those slots and working with the services and working with our veterans, our wait time dropped down to 22 days, and that's rounded off. It's really 21.6. Oh, yeah, it's right there, 21.6. So that actually worked out. So we're actually rolling out something similar to the other services. Next slide. So this is our wait time for mental health. Same thing. Mental health at one time at the beginning of the year is at 31.8 days. Working with the services again, adding slots, making sure everyone is working up to their capability. It's 17.8 days. Now the wait time for this is also 20 days. So they're actually below the wait time standard, which is a great thing. So lower is better. Next slide. So this is medical specialty and surgical specialty. What this slide is really is everything that's not primary care or mental health, meaning this is like about 172 different services under this umbrella. So the wait times are going to be high because you do have services within there that's 80 days, but then you also have some in there that's 15 days. So this is the average for all of those areas. Now, for this area, right now, it's down to 61.9 days, but this is an area, both these areas, medical specialty and surgical services, are areas that we targeted 7 different stop codes. And for those stop codes, those wait times, some still exceed the 28-day standard, but they have been coming down. So that's what we got going on for that area. So, no shows and cancellations. So I'm going to turn my back to this slide. So with no shows and cancellations, we go by what they call no-show rate combined. What that means is appointments canceled by clinic after their appointment. We got to get that and maintain below 1%. Canceled by patient after their appointment. We have to keep that down to 2% or less. No-show clerk indicated, which is my ask of all of us that's veterans. Those are appointments that the veteran just decide not to come in. Again, life happens and we all understand that, but the ask of the VA to our veterans is to give us a call, send us a message, let us know you're not going to be able to make it. Let me see if it's on the next slide. Is the numbers on the next slide? Okay, so this is ways to cancel, but I'm going to talk about some of the numbers. For the month of June, we had 11,000 no-shows. What that meant is that those 11,000 veterans could not make it to their appointments. However, it didn't give another veteran an opportunity to get that appointment slot. So we're asking that for all of our veterans, help us, help you by giving us a call, sending us a message to let us know that you're not going to be able to make it so that another veteran can use that appointment. So this right here is ways to communicate about your appointment. Call us or send us a secure message. Ensure you receive detailed vet text appointment reminders by responding to any reminder with your zip code. Telephone or text reminders allow you to confirm or cancel your appointment. And with that said, this is a way that you can make sure we're on point. If you didn't get a text, let us know, because that might mean that we have a wrong number for you in the system. If you didn't get a postcard, let us know, because that's one of two things. The report card, the postcard reminder may not be set up in that clinic, or we have a wrong address for you. So please help us, help you. When you check in for your appointment, tell the clerk you would like to verify your information, your demographics, so that we can have all that correct information. Okay, so right here, this is talking about basically the same thing I just mentioned, but it's talking about for the entire year. So, for example, it says Atlanta has completed 812,660 appointments since October the 1st. Our no-shows and cancellations represent a total of 91,590 underused appointments. So again, just imagine 91,000 veterans that could have used the slot that was left vacant from someone not giving us a call, letting us know they're not going to be able to make it. Are there any questions? I believe that was the last one for me. Let's see here. We can work together. Okay, so this one right here, how can we work together to reduce last-minute cancellations and no-shows? Please let us know when you have a new phone number, basically the same thing I just mentioned. Review your appointments on My Healthy Vet. Cancel in advance if you cannot keep the appointment, allowing others to use the appointment, as I already alluded to. Share your feedback on any barriers, which is also what I just mentioned. So again, help us help you. Okay, and here are some phone numbers. So 404-321-611, then press number 2. And this is how you can communicate about your appointment. You can also use secure messaging. Telephone and text reminders allow you to confirm or cancel your appointment. Vet text appointment reminders. If you have previously opted out and would like to receive text messages again, simply text the word START to 53079. To receive PHI, your personal health information, detailed appointment reminders. After your response regarding the appointment, respond to the same text again with your zip code. And then the last bullet, confirm or cancel your appointment at the time of the reminder. This helps us to reschedule the appointment so you no longer need and allows you to contact you sooner to schedule the care you need at a more convenient time. Again, these are automated processes. One of the other things that we're also doing is, it's not all areas, but in some areas, we're also trying to do live reminder calls to contact those veterans. So that's another reason we really need that phone number and the demographics updated.
Before we go to East and West, I really want to appreciate Mr. Yates for sharing the information. For access, it's really important that we let our vets know what we're actually doing to solve the problems that have been brought to us. And access has been a big problem here in Atlanta. Sorry about the fly, it came with the room. I do want to emphasize that over the last year, our team has been working diligently with providers, with executive leaders to really improve our numbers so that we can, one, improve our wait times, meaning get you in an appointment a lot quicker, and two, make sure that we're increasing access as best as we can to be more efficient for our veterans. One thing I will tell you, we have over 100,000 veterans in our healthcare system alone. We do not have enough providers for every veteran, right? And we're aware of that. Even out in the community, there are not enough providers to cover the amount of veterans that we have in this area. So we are working as best as we can to optimize the people that we do have and optimize the care that we can provide. And then to partner with our fellow providers and fellow healthcare systems in the community. So although our systems are not always easy to follow, we are trying to make them a little bit more accessible, which is why we're tapping into the technology. Again, if you're not great with technology, that's still okay. We have people available to help you resolve those issues and get you the care that you need and the support that you need. So reach out to us as often as you need to so that we can make sure that you're getting what you need. All right, let's go to our outlying sites of care. So Mr. Miller, are you online? We can hear you.
Good afternoon, everybody. I am Samuel Miller. I'm the East Regional Administrator for the Outlying Sites of Care. The East Region team, we provide administrative oversight and operational support for 11 clinics. We have Fort McPherson as considered a medical center, and I have 2 multi-specialty clinics, which is Atlanta VA Clinic. Some of them call them Arcadia Clinic, if you're familiar with that, and Pike County, which is located in Zebulon, which is a few years old. And those are my 2 multi-specialty clinics. So my staff consists of myself, work out of Fort McPherson and Atlanta Clinic. I have Mr. Davis, who is my site manager down at Pike. I call him my runner because he covers a lot of the outlying sites of care due to our staff shortage and all. So he does a lot of running for me. I really appreciate what he does. And fairly new to the team is Mr. Justin Hatnot. He's my administrator, and he also works out of Fort McPherson and Atlanta VA Clinic. Next slide. So the realignment here, we direct contracting oversight, realignment under regional office, increase effective lesser communication, decrease timeline to issue resolutions. So basically what we do is we basically get with the lessors and the property manager to ensure things are working and are operational out in the outlying sites of care. So we are Core 2 trained as well, so we are authorized to talk to the lessor and make sure that they are doing what they're supposed to do to ensure that our clinics are fully operational and that we can take care of veterans. After I updated this slide, these are some of the things that we are doing right now, the operational things that we're currently working on to improve our patient care. If you've been to Atlanta Clinic, we have a mammography trailer that sits in front of it. What we are trying to do is move that equipment out of that trailer up into the building so we can have more room and more space and be more effective for patient care. We're currently getting authorization from the lessor to do some modification, and once that comes back approved or whatever, then we could proceed once everybody agree upon to move that equipment into the building. Um, the dental service line has just received a new vacuum system. On my slide, it said it has arrived. However, it is installed and is working. It's working perfectly. And so, if you ever come to our dental clinic, our vacuum system is working. And we're also getting new chairs and cabinets for the dental clinic upstairs. So they're getting a whole new makeover up there to improve our patient care. At Fort McPherson, we are getting new chillers down at the domiciliary. Those things have been installed since the installation was built. And so we're now getting new chillers down that way for our domiciliary and residents. And also, if you're familiar with Fort McPherson, behind the credit union, building 135, we are getting ready to renovate that building so we can provide operational for our VA, Fort McPherson VA police. So we're looking forward to that getting on the ground and underway so our VA police will have optimal space so they can operate over at Fort McPherson. I believe that's all I got on this slide. If there's any questions, not be followed by Mr. Gary Bruton.
Mr. Bruton, are you online?
Yes, ma'am, I am. Can you hear me?
We can hear you.
Okay, thank you. My name is Gary Bruton. Again, I am Mr. Miller's compatriot on the West region. The West region, you can go to the next slide. I say it's from Blairsville in the north to Noonan in the south, and goes from Cobb County and our multiple clinics we have in Cobb County out here to Carrollton, where I reside on a daily basis. Part of my team, Mr. Derek Jones, who is over the Cobb Multi-Specialty Clinic that we opened up in the end of 2022, and Ms. Kristen Smith, my administrative officer for the region. You'll see, again, the Trinket Davis Veterans Village has a 42-bed community living center and a multi-specialty clinic, and thereby designated as a medical center. So not to repeat what my compatriot in the East mentioned, a couple things in the West that are expanding access is we've recently implemented and activated a mobile lung CT unit that is currently residing at the Trinket Davis Veterans Village. From here, it's the plans in the future are to let it to deploy to various CBOCs in the region. We're currently in the throes of contractor building us an additional house to our community living center. Our community living center is in a greenhouse model. We currently have a 42-bed capacity. Each house has 10 to 11 beds. This additional house will be our fifth house. 12 additional beds will put us up to a total of 54 community living center beds for veterans. The project completion for that is targeted for 2027. So those are kind of the highlights for the West region. Back to you, Dr. Lee.
Thank you, sir. So as you can see, we've had all of our team talk about what they do, how they contribute to access. And so I have some good news and I have some bad news. So I'm gonna start with the bad news first. This will actually be our last Access Veteran Forum, not for the year, for the foregoing future. However, we still have our veteran town halls, and we will be providing this information during our veteran town halls, as well as having the leaders at those meetings as well. So the same things that we're sharing here in this session will be shared, any updates, any changes will be shared at our veteran town halls. That information can be found on our social media as well as on our main VA website. We implore you to come to those, tell a friend, invite a friend, because we'll be giving great information. And if there's issues that you're currently having, we can help you resolve those issues on the spot just like we can today. So I just wanted to share that information with everyone who's here and on the call. And now I want to just open it up for any questions.